Hey, it's Patty. I just wanted to review some hand and finger stuff that we see in symptomatic hypermobility, connective tissue disorders, and I'm going to go through what we see in the literature, kind of anecdotally, what we see in clinic, and like everything else that I ever talk about, there's always going to be uniqueness out there, so can't possibly cover everything. So something might be related to symptomatic hypermobility that I don't present in here, but this is just to at least provide the basics and give a better understanding of what's happening at the hands. But we do know that there's a lot that happens at the hands. We have almost every type of EDS has something that's noted about the hands or the small joints, things like that. The tenacin deficient EDS. We see hand and foot deformities, cardiac valvular EDS. It might be generalized hypermobility throughout the body, or we can also see it just restricted to the small joints. So hands are involved in that. The myopathic EDS also might have hypermobility of the distal joints, which means that the hands and the fingers. Vascular EDS, again, also hypermobility of the small joints, which would mean the hands and even down into the feet and toes. Dermatosparaxis EDS, more so not necessarily as much of the hypermobility reported, but we do potentially see shortening of the bony structure of the fingers and into the hand, and then some palmar wrinkling changes. So the wrinkling are the lines within the hands. Classical like EDS, we can see atrophy, so weakness that happens within the hands and also in the feet. And then acrogeric hands. Acrogeric means that they look more elderly than the biological age of the patient, so aged looking fingers. Mallet fingers as well, so changing of the shape of the fingers with some tendon problems that might happen. Clinodactyly is usually an inward shift of the finger, so it's kind of like a curved inward position of the finger that can happen, and brachydactyly is shortening of the fingers. Brittle cornea syndrome, we see arachnodactyly, which is lengthening of the fingers, so longer fingers than expected. Hypermobility of those distal joints again into the hands. Interestingly, brittle cornea syndrome, you can see a mild contracture, so where the pinky can get stuck into a little bit of a flexed position. So again, connective tissue disorders are just that. They don't always mean that everything is going to be hypermobile. We can actually have some contractures with abnormal connective tissue responses. Spondylodysplastic EDS or SPEDS, depending on the type that is present, you're going to see a number of different things. So I'm not going to go through each one of these specifically, but we do see potentially changes in the wrinkling or the palmar creases. There is generalized hypermobility or within the distal joints, so the hands. We see a lot of these peculiar fingers, so slender, tapered, maybe spatula-like long fingers that can be present. And with one of the types anyway, there might be some atrophy in spondylodysplastic EDS, some atrophy in the thumb meat. So that's that thenar muscle group that's down there. Musculocontractural EDS or MCEDS, again, that peculiar finger shape, so cylindrical, tapering, slender type of fingers. And periodontal EDS, PEDS, we might see more hypermobility of the distal joints as well, which are the fingers and also into the toes, but for today we talk about fingers and hands. So a lot of stuff is reported in the hands and the fingers for those with different types of EDS, and we do see it along with hypermobile EDS as well. So we can have a number of different types of hypermobility that happens at these small joints, right? And when that happens, it can really actually start to affect our daily life and our functioning of those hands. So in the picture there, those little red circles are showing you what the IP joints or the interphalangeal joints of the fingers are. So those are the smaller joints. The proximal interphalangeal, PIP, is the lower one of the four fingers. And then your your distal interphalangeal joint is the one that's further away from your hand. And that's the little circles on the top of those four fingers. So DIP on the top, PIP in the middle, and then the thumb just has one IP, which the thumb's in a different lecture. We'll talk about him in a different space. But we can have a number of different ways that we experience hypermobility in these fingers. Flexion and extension really is this kind of plane here. So we can see overextension, we can see hyperflexion that happens, which happens a lot with functional activities, especially gripping things, like when we grip a pen and we have hyperextension that happens at that little joint at the end of the finger. Lateral deviation can happen when we're manipulating things, grabbing things, pulling and twisting. Fingers get caught in things like that. So lateral deviation is really when we have a sideways type of movement that's applied to the finger. You might feel like actually feeling the instability, what feels like gapping in the joint or an opening or an overextension that happens. And that can be a sign of instability. And it's really hard to realize that this is happening, right? Especially if we're using our hands throughout the day and we've normalized it. But those are some words that might be helpful as you're doing things. Oh, that's what gapping is. It is some hypermobility. Might I need some extra support? Maybe. Everybody's a little bit different. Also, some shifting when there's overpressure. So, gripping and turning and really manipulating with the hand, shifting can be felt in the joint. So, it's not necessarily opening or stretching apart, but there's just a little shift that happens. Typically, as we talk about some of the other joints in the body, when we get it, we might have some laxity that causes it to have alignment problems and be stuck out of place. So we see that a lot with the shoulder, where it's really hard to reach overhead for those that have a forward ball in the socket because of alignment issues. We don't always see that with the fingers. Can it happen? Sure, of course, absolutely it can. What we typically see are more so this functional instability that happens that when you apply pressure, it's hard to keep the fingers together. And part of that is because of the anatomy of the hand, because we have all of our muscles are really down in the palm here, and these are really just tendons that are up in here. So physics-wise, holding those joints together all the way down in the fingers becomes more difficult to do it just from a tendon rather than having a meaty muscle belly surrounding that area there. And then we also have individuals who, even without applying pressure, might just be able to actively demonstrate what they call the swan neck position, which I can do. So if they have volar plate problems. So that's usually extension that happens at the middle joint and then flexion that happens at the little end joint there. And that's usually because the volar plate, this thing that's supposed to be stabilizing underneath, for whatever reason, isn't enforced enough or isn't doing its job. Okay, so a little bit more about kind of this functional type of instability too. Um, Again, we tend to adapt and not realize that we have adapted uh, because we have to get through the day, right? But again, sometimes having a little bit more support or doing the right exercise to support this can actually make a world of difference from just functional daily activities. So it's worth a try if you haven't worked with a hand therapist before or addressed this before, because we do tend to kind of focus on bigger joints, bigger problems. But this can also be something to help just on a daily basis. That hyperextension that can happen, you can see that in the top picture there. Hyperextension of that DIP or that distal interphalangeal joint can make gripping, what we call standard utensils, difficult. So thin little pens made for people that don't have so much hyperextension can become very difficult to manipulate when you have so much hyperextension, and it can cause you to grip even harder, feeding into the problem that's already there. With that position, with that trying to stabilize on this little pen with this hyperextension that's happening can fatigue somebody a lot easier when they're writing and can eventually cause pain. So while many of us have switched over to typing things and voice to text, this is still potentially problematic for those who do write with a pen and also can be very problematic for kiddos in school as well. These normal daily functional tasks can become more difficult. They can cause pain, subluxations, and overextension of certain joints that happen. That bottom picture is just at rest. The finger position is not optimal. Therefore, if anything hits it, it's not set up for a great response, right? So working on the stability and the position, or just bracing and supporting can actually help somebody get through daily functional activities and prevent injuries from happening. We can have additional injuries from sports or daily activities, and that's gonna create even more complex presentations and lead to more chronicity. So it takes a whole lot longer for somebody to heal. potentially that has an injury on top of hypermobility, and it depending on what they're trying to get back to as well. Okay. We can't forget the other joints too. I know we focus a lot on the ones that are much easier to put ring splints on, right? But then we have the knuckle joints down here at the hand, and they can actually cause problems for individuals that have laxity. Not everybody has as much laxity with symptomatic hypermobility and the group of connective tissue disorders in these knuckles, but we do have some that are affected, and this can really feed into functional problems for an individual. So, when we have instability that happens, what we call the MCP joint, so that's the one, those little red circles on the x-ray there at the base of the hand, what we call the knuckles. So you can have hyperextension like that first picture of the actual hand there. You can have hyperflexion, so that's the tucking the finger all the way down and in, and then you can have rotational laxity as well, which is more of a twisting, turning type of mechanism. Now, with these, what I've seen, because there's already more motion that's available, I have a lot of people that more so feel the sensation of it coming out of place when using it rather than being stuck out of place or, you know, feeling a dislocation or something like that. Can it happen? Absolutely. But this more so feels like it's kind of stuck out of place or sliding out of place when gripping and especially twisting motions. So yes, issues can occur at this joint, especially with the type of force that is being shown here. And you look at this and you're like, why would you ever apply force like that? In my personal experience, that was just plugging in a plug to an outlet. It's that same type of uh, force that was applied to my hand. So this can actually happen with a lot of daily activities that we do. We just use our hands and manipulate them in so many different ways that you can actually get that force that's applied where you have a downward or an inward force on the lower part and then an outward force on the upper part of the knuckle. It can happen just with gripping type of activities. Okay. Also happens when the fingers are hit. So, which is, I have a lot of predisposing risk factors, right? Martial arts is, I have done this dislocation twice to my index finger with martial arts with somebody kicking the end of it. But it can happen with basketball or football or catching your finger in a jersey. And when at home, though, you can snag your fingers in clothing or bed sheets and things like that. So this can happen there. You might need extra support in that area as well. Not as easy to support as some of the other ones, but I didn't want to leave this one out because we tend to think about the other more distal fingers, but this area can be problematic for people. Okay, so when we're talking about the fingers, yes, we can do finger exercises, gripping and things like that, but we have to remember the old saying for distal mobility, we have to have proximal stability, and it is true. So basically, we have to have a stable base that's nice and strong so we can manipulate these guys and move them because they're well supported by this hand. So typically, when I work with people, I want to actually make sure that they have a strong hand before manipulating fingers. Now, everybody's different, every approach is going to be different, but it's just something to think about. We should be able to maintain this arch position. My buddy Heather Purdon, for those of you that have seen her, she's doing classes out there and helped write one of my books with me, talks about this rainbow position in the knuckles. That's very important. That rainbow position tells us that it's aligned as it should in this functional position with the muscles engaged and ready to go in what we call the interossei or the intrinsics of the hand. Okay, so basically just know we're supposed to have this nice knuckle position or rainbow knuckle position, not flat, okay, and not super scrunched up, which both of those can happen if we have some weakness in the hand base itself. So we might have to go back to just supporting and teaching somebody how to create that rainbow knuckle position. Okay. Place and hold techniques, but just what I'm doing is just trying to create an actual rainbow position. Also, some individuals might need a splint or some sort of support that's created by somebody who works with thermoplastics, like a hand therapist, to create that base, to be able to support and just teach the person where the knuckles are supposed to be in space. It can be very hard if you haven't held your body in that position for a while. So this is just another retraining position. So after like just place and hold, and I'll argue, again, it's so different for everybody. If you can't seem to get that rainbow arch position by just using your hand, even though we would consider adding a ball more advanced, sometimes the proprioceptive feedback is easier for people. So that first position there on the left is just a ball underneath my hand to promote the arch. And I am not squeezing with my fingers. I'm actually retraining the arch. So what I'm doing is I'm suctioning my whole hand to try to engage with the ball. So I'm trying to suction, press down all of those parts in contact with the ball so that it squeezes the intrinsic muscles and then relaxes and squeezes and relaxes, but not the fingers, just the palm. Okay. Second level up is by adding in a more intrinsic interossei, as we call them, those little tiny muscles in the hand itself. So we're working our way down the hand to strengthen those fingers is by working the muscles in between. So in the second one, I'm holding the rainbow position and I put a pen in between my fingers. So I'm holding, trying to suction the ball underneath while I'm also squeezing the pen between my fingers. It's a lot harder than it looks. Okay. But hard doesn't mean that it's straining or difficult. It's just, or difficult in the sense of causing pain. This is just really neuromuscular retraining, and it can be very, very hard to develop those little nerve firing patterns to put you in the right place. So not difficult in a painful way, but difficult more so for a lot of people in a challenging way is the right word, I suppose. That last picture there is just another way to do it. If you don't have a tennis ball, that's my hand on my knee. The knee for most people forms a little bit of that arch naturally. So just bringing your hand to the end of it, again, engaging and just the hands trying to suction on the knee itself and then having a pen in between to squeeze. And I don't ever give counts out for anything because some of my individuals start at one repetition. So I don't care where everybody starts. It's really what you can tolerate and advance through, but those are just some examples. Um, Talking a little bit more about support systems. So with that, what we call the metacarpal phalangeal, that knuckle joint that's down here, um, there are some different splints that are out there. The MCP support or the EDS splint. Um, and sorry, I don't have pictures. I try not to like just show you like an advertisement for somebody's EDS ring splint page. But what we have for the MCP supports is it's around the knuckle, and then you'll see on either side there's a metal piece that comes down on either side, so it stabilizes on either side, like wearing a ring that has a support on either side of the hand itself. There's something called the buddy splint or the yoke splint. So the buddy splint are three rings that are attached together that just help stabilize, and it doesn't allow your fingers to spread too far apart. The yoke splint is like an old yoke that they use for yaks and other farm animals. But the yoke actually will go under one of the fingers and over two others, so it's usually two rings, and then the middle one is just a trough or a support. And that again can help stabilize fingers by kind of using the spacing next to each other. And then compression gloves, we wouldn't think about this, but sometimes just a little bit of feedback on compression gloves will help a little bit with lower levels of instability or just help hold things in better alignment when we're doing functional activities. Okay. Support for the interphalangeal joints or those IP joints, the little joints of the fingers. Um, these are some different companies that are out there. Silver Ring Splint Company works with therapists, so you do typically have to go see an occupational therapist or a hand therapist or somebody that has the measurement devices that the company uses to be able to get fitted for them. Sometimes they can be covered by insurance, sometimes not. It's a little bit longer of a process to be able to find somebody, to have them fitted, to get them refitted if needed. A lot of therapists will have you try their thermoplastic splints before they order the ring splints. But it is something that sometimes can be covered by insurance for some people. So I'm not dissing it. I'm actually a hand therapist. I just don't use it because it's not as efficient as I'd like to see yet. Um, Eva Bell jewelry. There's others on Etsy's. We design oval eights. Oval eights are the plastic ones that you might have seen before that just kind of slide on. Great to test things out with for sure. And swan neck splints as well. There's a whole bunch of different types of splints out there. These that you see are in the picture are just swan neck splints. So they're just meant to prevent hyperextension. You can see with the both of those, the back finger, the distal interphalangeal joint, the DIP, and with the front finger, you can see the laxity in the proximal interphalangeal joint and the difference that is made when the splints go on. They're much more aligned. They're not hanging on those ligaments anymore. Interestingly, everything's connected, right? So they did this test where they gave people finger orthoses, with hypermobility, and they found that there was improved hand function. So they needed less time to perform the test. They were writing tests, picking things up, so these proprioceptive tests. So when you gave people finger orthoses, functionally, they had some changes. Interestingly, they also saw that there might be an improvement in attentional demand. So actually, like thinking and processing might have improved by just putting ring splints on, maybe because it's taking a little bit of the toll off of the nervous system that's being overtaxed by hypermobile fingers trying to do something. So just interesting to see that, especially when we're talking about kids and 504 plans and things like that, having some sort of writing support or having splints might actually help attentional demand in school. Speaking of which, this little guy is much larger now and refuses to wear his ring splints. But when he did, because we're of that age now, but when he did, you can see this is something that we had to do for school. And that's how he writes with his left hand on the left hand side. He has the ape grip. We can't change it. He is so flexible. His fingers are so bendy that it's fatiguing. It's so tiring for him to try to hold the pen in a normal fashion. So the picture on the right is actually, I handed him his ring splints. We put them on. I didn't say a word to him at all, and that's what he did with his pen. So pretty awesome that it really does help support grip to be in a functional grip without having to say anything, retrain. So I thought that was just a neat picture. But also it lasted maybe 6 months, and then we had to actually change to the fatter grip pencils in school and pens and all the supports because he didn't want to keep taking out the ring splints. But just to see, especially for our adult population, like it could certainly help you uh, maintain a more stable grip. Also, in case anybody's wondering about 504 plans and kids that are difficult to follow, what's set up for them in school, especially if it takes bringing things out, putting things back, like all of these hand grip devices. This kiddo currently does voice to text through computer, and that is what is supporting him through school. Okay, so and then again, if ring splints aren't working, pencil grip supports and things like that can be really, really supportive. That actually makes the width of the pencil or pen wider. Okay, other supports. There's a lot of stuff out there. This is not my specialty. I am a hand therapist in the sense that I have a physical therapy background and I am great with anatomy, but it's really the occupational therapist. And yes, there's other hand therapists out there that do a lovely job. But talking about the functional support, so being able to thicken different handles, whether it's in your kitchen or in your bathroom, to just make things a whole lot easier for you. Modified scissors, kitchen utensils, all of these things that they actually make now that come with better supports, better grips. Um, if there's hand problems, especially if they're active and irritated, please use one of the grippers when opening jars. It'd be super helpful. Some that are very affected with their fingers might have to use lever doorknobs rather than turning doorknobs, just a little bit easier on the hands. And then adding the squeeze lever devices so that we're not pinching, but we have a larger grip device to be able to access certain things that require pinching. Different therapeutic strategies. We're going to run through these here in this presentation, and I'll have other videos just separately having them in the future as well. But tendon glides, grip positioning, thumb-based exercise for grip support, and ergonomic support we'll roll through. Again, just a number of different ideas that might be helpful, but everybody's going to be a little bit different in what's specifically going to support them and what works for them and doesn't flare them up. So tendon glides, this is an exercise to help mobilize all of the different tendons in the hands individually apart from each other. So especially if we have fascial restrictions, which is more common for a lot of us in our zebra dazzle, and it can help with alignment, especially neuromuscular retraining. So this is a good one to start with. There are actually not as many positions as it looks. We actually come back to this flat hand in between each exercise there. So we go flat hand, what we call hook position there, back up, tabletop position, back up, fingertips to the palm, back up, and then a grip position and back up. Okay, so this is great for neuromuscular control because anybody that was watching me probably saw a couple times and they're like, oh, she overextended. I did, and you shouldn't. So we don't actually want to use our hypermobility. We want to train our body. When we're talking about this tendon glide, we want to train our body to work within the limits that we have in a functional and gliding way. So when we come up to the top, I did at one point, I went back a little bit too much. So we should be flat. Can we retrain our hands to come back to flat all the time? And then this hook position, ooh, that's a lot of us go right back into the boop, support ourselves right there, but nope, the neutral position is actually straight up, not back. Okay, so again, this is really great for retraining, also great for fascial mobility in the hands. Grip positioning. So there's a lot of different exercises to do for grip positioning. We basically want to teach somebody to stay in a neutral wrist to be able to support the fingers, to keep themselves in a rainbow arch position, and then working on intrinsic muscles to support the fist position before we grip. So it's grip positioning. So can we maintain a neutral wrist position, not up, not down, neutral wrist position, the rainbow arch position, and then engaging the intrinsic muscles, and that might be with a tennis ball. Okay, so like the picture I had earlier. And then we have these thumb-based exercises for grip support. So we have to remember that we have these really cool opposable thumbs. Really cool, right? That can cause problems. But they're huge in the world of function for us, okay? So when we talk about our fingers too, we have to remember the thumb itself reinforces the rainbow position of the arch. So we might want to do some thumb exercises, different video, but we might want to do some of that to help support, okay? So, and that's what I always say is if working on the hand, if the hand is your problem and working on it seems to be irritating, go back door. Can we work on the thumb? Can we work on the wrist? Can we work on the shoulder? Where can we work that's helping to stabilize and maybe not directly affecting it, right? The thumb is huge for pinch gripping. So pinch gripping is what we call fingertip to fingertip this way, like that O position, right? And then we have the key grip position, which is over to the side as well. So huge functional motions. So sometimes working on those helps give us a stable base to work some of the other fingers off of as well, okay? And then ergonomic support. We kind of talked about it before with some of the utensils and having handles reshaped or finding handle support to be able to reduce the grip strength on certain things. Working on ergonomics at the workstation if you have one, or whatever you consider your workstation, art, drawing, writing, whatever it might be. Can somebody come in and make that a better functional space that might be less stressful on the arms and the hands? Self-care, again, what are we using as our devices? Hairbrushes, combs, hair dryers, all of those might be able to be modified, or your position might be able to be modified to allow for easier access, especially with the hands as something like a hair dryer. Can you actually prop your arm up on something while drying the hair so you're not activating all of those muscles. Lots of little sneaky ways around all of this. And then what are your hobbies? Sewing, knitting, crocheting. What do you need support with? And this is occupational therapy. Occupational therapy is great with dealing with solving some of these functional issues. Okay, so back to kind of where we start. We really always want to start with alignment, neuromuscular control. Can we stabilize even before we work on strengthening? We need to make sure that we can do that. Do we know where our body is in space, and can we stabilize it there? Then we can talk about strengthening. So we really have to talk about neuromuscular retraining first. So do you even know where your hand is in space? When you show somebody your flat hand, is it like the first picture where you're using all that hyperextension that you have, or can you use it as an exercise and just bring it into a neutral position and engage the muscles and then relax? Okay, so can we just find a flat hand position for a neuromuscular control exercise? We can do this with other exercises as well, with what we call a place and hold, where we can actually use other body parts to support us. I'll have other videos for this too. So pinch grip. So pinch grip is fingertip to fingertip like that O, and you can see mine collapses right there. Now it looks kind of like an eagle eyeball or a rooster or something. So place and hold would be placing the joint in the correct position and seeing if I can now hold that O rather than allowing it to collapse. Okay, so you place it there, and now can you activate and hold it on your own? Okay, same for the key grip. When we key grip on the side, sometimes we have this muscle collapse. Can we hold it out? And now can you hold that same key grip without letting that collapse? So it's not cheating to place it in the correct position, but can you hold it there? That's the key with these exercises. Okay, so to summarize all of this, and this is really just general presentation, I'll have more for you over time on the specific exercises and things like that, but just understanding that you can have subluxations or instability or increased mobilities throughout really any of the finger joints, okay? So from the position that you're using for different activities of daily living, it can really start to pull things out of place. It happens to a lot of us. A lot of us might normalize it. So ring splints and orthoses can actually be very helpful to provide stability and help retrain where the finger is in space. Typically, like the baseline that we use for a lot of that plane of motion where extension and flexion, so kind of the hyperextension that happens in this plane here and flexion, are the swan neck splints. So to prevent some of the hyperextension that's happening, we can put a swan neck splint around those joints to start. There's a world of other types of splinting. You should really talk to a specialist about it, but it can be very, very helpful to reinforce if we feel like our fingers are a little bit too bendy. We want to teach ergonomics in the hand. So we want that natural curve of what we call the transverse arch of the palm. So we want to be able to keep that rainbow curve to be able to prevent instability from happening. You need that stable base, okay? So when we first start working on alignment and positioning, we can work on finger control and finger strengthening, but you have to work on the alignment piece. So don't forget to watch where your fingers are in space, make sure that they're not overextending. It really is about neuromuscular control and alignment before we strengthen, okay? And then certainly see an occupational therapist or a certified hand therapist if you have issues in this area. Again, this was just general brief information to kind of show you what's out there and in the literature. And then splinting is great. If you haven't tried splinting before, it can actually help reduce pain and increase function. But you might need to go find a specialist to be able to work on which splints are right for you. But hopefully this was a little bit helpful and maybe a little bit validating that stuff absolutely does happen in the fingers and hands. We just tend to not talk about it as much. And references, in case anybody wants the references on just some of the slides that we talked about in the studies. Okay, but thanks for listening.